Is prednisone addictive? Does it cause addiction? Like opioids and benzodiazepines? Well, that's a really good question, and it's a really confusing question that is really a lot more nuanced than black or white. The thing about prednisone and any drug is the way it's working is it's causing changes to your body. And so your body can change in response to it. So addiction is different than dependence. Dependence is when your body cannot function without the drug because your body has changed in response to being given that drug. Whereas addiction is dependence plus a compulsive desire to acquire more of that drug. That despite negative consequences, whether it's stealing, lying, cheating, committing other crimes, people insist on getting more of the drug. That's addiction. And that can happen with alcohol. That can happen with morphine. That can happen with fentanyl. That can happen with all sorts of illicit drugs. It can happen with gambling. You know, when you are absolutely persistent in getting back more of that thing, even though there's negative consequences, that's addiction. But I'm not aware of anyone who treats prednisone that way. Prednisone, your body becomes dependent on it. It can't really survive very well without it, but people aren't breaking the law to get access to prednisone. I don't know of any stories about that. Nobody's ever mentioned it. My daughter, she was so addicted to prednisone, she broke into somebody's house who was taking it. That's never happened. Whereas that often happens when it comes to pain medicines, right? So what is prednisone doing instead? Prednisone is causing changes. In fact, it affects up to 2/3 of genes in your body. And those changes make your body dependent on it for certain functions, including your blood pressure, your blood sugar, your immune system, your ability to cope with stress, and on and on. And so what you need to do is never go cold turkey off of the prednisone, because you must give your body the chance to change back. You need to give it that chance to change back. And so what are the symptoms of what is called prednisone withdrawal? You can get opioid withdrawal, like pain medicine withdrawal. You can get benzodiazepine withdrawal, like if somebody goes cold turkey off of Xanax or something. But prednisone withdrawal is its own nasty beast. It's hard to tell whether you have it because it feels a lot like other things. For example, it feels a lot like the flu because you get fatigue, like you don't really want to eat. You might get weight loss. You might have low blood pressure. You might have joint pain and muscle pain and mood changes. You might get dramatic anxiety or depression or sleeping changes. Lots of things that are non-specific. Could be a sign of an infection or it could be the sign that you're going through withdrawals. But the way to find out is to go back up to the lowest effective dose where you weren't feeling that way. So for example, say your doctor's having you drop 5 milligrams every week and you went from 15 to 10 to 5. And at 10 you felt fine, but when you dropped to 5, you suddenly felt sick. Like you felt like you had the flu or something. And so if you're feeling that way, if you're having those prednisone addiction symptoms, which are really prednisone withdrawal symptoms, then just go back up to that dose where you weren't feeling those symptoms and stay there and taper slower. So instead of dropping a humongous drop of 10 to 5, that's a 50% drop. Because what's important when it comes to tapering, that's the process of going slowly off of prednisone, is the percentage drop. So going from 40 to 35 was a much smaller percentage compared to 10 to 5. That's a 50% drop. And so you want to keep the drop, if you're struggling with withdrawal symptoms, closer to 10 to 20%. So instead of dropping from 10 to 5, you drop from 10 to 9 or 8. But you can't get there with a 5 milligram tablet. You'd have to have your doctor prescribe 1 milligram or 2.5 milligram tablets to get there. And if you're suffering these prednisone withdrawal symptoms, you need to be helping your body recover by giving it back what prednisone has been stealing. Prednisone has been stealing things like magnesium, potassium, chromium, zinc, vitamin C, and on and on. Things that your body absolutely needs to build back up its ability to function without prednisone. And so if you're feeling prednisone withdrawal, then you need to give back those nutrients to help you recover. And you need to do that for at least while you're on it and a month after to fully help your body recover, potentially up to 3 months after. And if you want to know the best way to give back the exact nutrients you need while on prednisone and in the exact right doses designed for people on prednisone, just click the link below and you can find out exactly what you need to take while on prednisone, while suffering from prednisone withdrawal, and while recovering from taking prednisone. Just click the link below and I'll send you right over exactly what you need while taking prednisone. Signing off as Dr. Megan, your prednisone pharmacist.